This is the interior of the knee. You see the kneecap or the patella on the top. It sits very nicely on the femoral trochlea at the bottom. This is the inner side of the knee and this is the outer side of the knee. These two portions of the knee are called the medial and the lateral gutters respectively. This is the proper knee joint as we know it. And here you can see a very enlarged view of the knee ligaments. That's the inner side of the knee and you see the torn medial meniscus. Whenever we make an arthroscopy portal, we use a guiding needle and make it with a very tiny blade. These things look big on the arthroscopy monitor because that's the magnification that the arthroscope gives you. This is a 2.4 millimeter instrument known as the probe, which is the extension of our finger. And here we see that the medial meniscus has a frayed surface and an irregular surface. It is also torn. So we are using this instrument. It is called the punch. It does exactly what its name describes. It punches out tissue. This is a rotating knife known as a shaver. So the punch creates a lot of debris inside the joint, which the shaver removes. Once we punch off meniscal tissue, we keep on probing till we are sure that we have a stable rim of meniscus. This device is the radio frequency. We use it very sparingly to trim the edges of the meniscus. It's a thermal device and we fine tune the meniscectomy with a spine probe. This is a 2.4 millimeter punch. The previous punch that you saw was a 3.5 millimeter punch. And again, a probe to check. Here you see that there is a small portion of the tear which is left behind. Nothing needs to be done for it. We use a diamond rasp to rasp the edges of that tear so that the meniscus heals on its own. And now we go on to the outer side of the joint to see how a normal meniscus looks like. This is the intact lateral meniscus and you can appreciate its smooth contours. The cartilage is okay. The ligament you just saw peeking through is known as the popliteus tendon. It's a small tendon located on the outside of the knee. So the outer compartment or the lateral compartment of this person's knee is absolutely fine. It is the inner side which had a tear that we have addressed through what we call a partial meniscectomy.